I want you to imagine this. One day, you go to hang out with your friends, and then when you get together, you notice that one of your friends seems a little bit more distant than normal. They refuse to let you into their thoughts. You find out that they've even quit a hobby that they've been playing forever. You meet up a few times with your friends during the next month, yet this person's mood hasn't gone back to normal. You're confused as to what's going on. It seems as though they're a completely different person. The situation I just described is familiar to many people, and many people can relate to that person. Major Depressive Disorder is one of the most commonly diagnosed disorders of the DSM-V, a big book that counselors used to define disorders and mental illnesses. This is what most people are talking about when they say depression, but as we'll find out later, there are many different types. The DSM-V suggests several symptoms associated with major depressive disorder. The first is, of course, a persistent sad mood. However, something that may surprise you is that it can actually manifest itself as irritability and anger in children and teens. The second symptom is, forgive me if I pronounce it wrong, anhedonia, which means more or less a disinterest in enjoyable activities. So say, for example, you really enjoy going for hikes or playing video games. If you're feeling depressed, you won't really care to do either of these. Having suicidal thoughts or actions are other indications of depression. I would highly recommend seeing a professional if you or a loved one is going through either of these. And if anonymity is of concern, there are suicidal hotlines and hotlines for people to report suicidal acts. There are other symptoms, but these are the main ones. For a diagnosis, these symptoms have to be present for at least 2 weeks, and they also cannot be caused by things like substances, medicines, previous medical conditions, nor caused by significant losses such as death of a loved one, financial ruin, or a recent handicap. As stated before, major depressive disorder is the one that most people are referring to when they talk about depression, but there are other ones as well. Persistent depressive disorder, also known as dysthymia, is defined as a depressed mood lasting for at least 2 years, with or without a major depressive episode. Dysthymia has less severe symptoms than major depressive, but they last for an extended period of time. Psychotic depression is depression accompanied by some form of psychosis, such as delusions or hallucinations, and they usually have a depressive theme. Then there's seasonal affective disorder, which is exactly what it sounds like. The onset of depression during the winter months when there is less natural sunlight. Symptoms usually recede during the spring and summer, and it's accompanied by social withdrawal, increased sleep, increased weight, and it predictably returns every year. Perinatal depression is major depression experienced during pregnancy or after giving birth, such as in postpartum depression. It's not to be confused with the baby blues. The baby blues is much more milder and it's shorter term. People with premenstrual dysphoric disorder have symptoms including mood swings, depression, irritability, anhedonia, lethargy, appetite loss or gain that occurs in the final week before the onset of menses and becomes minimal or absent in the week post-menses. Side note, it should be confirmed via a daily log after 2 symptomatic cycles. This is because of something called the confirmation bias. Basically, you only remember the times when you felt these symptoms, or you'll attribute your depression wrongly to your cycles, when it could just be depression on its own. Something to be noted is that these diagnoses shouldn't be taken lightly. In a later video, I'll probably go in depth on why diagnosis is controversial, but for now, I think I should inform you that there's a lot of information required in order to correctly diagnose someone, or yourself. You not only need to know the DSM like the back of your hand, but also background information of whoever is involved. I hope I've given you a good foundation on what depression is, its symptoms, as well as different types. Next time I plan to go over its causes, risk factors, and professional solutions. I hope you guys enjoyed this video. Thanks for watching.